this project was basically for a Fortune 500 company where we wanted to test out how technology can impact the lives of the low income urban population. So Dharavi, as you know, is one of the largest slum in Asia. So there's a very diverse set of audience to whom you have to cater to, and a very different mindset that you have to target when you're designing digital solutions. So I think that is very challenging. At the same time, it was also a learning experience for us, because for a large period we keep on designing for urban population, and we kind of get carried away about how things are done, and all things have to be done in a certain way. So this opened our eyes. I think this was the interesting project.
And could you tell us a little bit about how this project came about? What was the motivation behind this project?
So we have been working with a Pune-based company for a long time. They were into healthcare. We kind of designed different kind of portals for them. We designed clinical systems which are now being used in NHS in UK. So they kind of have a very good spread with respect to how they position healthcare as an offering in different strata or different sections of society. And that is when this was a very interesting thing that one segment of their organization was trying to do for the low income population in an urban kind of environment. And that was very, very interesting for us because it was very challenging. We never did something like that, and we kind of pounced on it.
So what are the challenges for an environment like that? So, yeah.
Okay. So see, mostly the population the population that we targeted was migrant slum dwellers. So these people who used to stay in Dharavi were, laborers working in construction buildings or maybe doing some daily odd jobs. They used to come from UP, Bihar, or other cities or other states. And so you have a very mixed set of population. They think in a very different way. Culturally, they are very different. So that is one important challenge. And then there are challenges which are pretty common across this kind of population, like the lack of knowledge with respect to how to interact with digital ecosystems. They usually used to have those kind of phones. I think this project we did in 2017. And it was very early when they started accessing, mobile phones. The data was still not cheap. Geo came in a little later with respect to, disrupting that data space. So people used to ration data a lot. So the power of that application, the power consumption, data consumption has to be very, very low. So you had to be absolutely particular about what are you really communicating to that audience. It was more content driven because it was healthcare and specifically for maternity care. So you need to teach them, you need to empower them with information. So what kind of information, in what form you have to give them, all those kind of things were challenging for us. And again, there were very interesting findings, like, the husband has the phone most part of the day. Lady is the target audience. And the lady of the house who is expecting at that point in time, they have trust issues with respect to digital or technology as such. So they either rely on doctors. So the trust hierarchy is really like doctor, mother or mother-in-law, and then they will be looking at some, adverts or, the least possible or the least trusted source is going to be print media or any other media for that matter. So these are some challenges that we saw. Language is another bigger barrier. So, English doesn't work. So you have to work in the regional languages. Right. And that too in a local slang, cannot really be Shuddha Hindi. So.
And you also mentioned that because it was Dharavi, it was a lot of migrant labor. It wasn't necessarily from Maharashtra themselves, but it was Bihar and UP and all those other places. So there's an additional layer of, a lot of different people coming in together. Right. So could you walk us through how you conceptualized this problem and went around solving it? And then what the final solution looked like? Because, we've talked, but I've not seen the final solution myself as well.
So I have a couple of screens that I can show and talk about the challenges that we face with that kind of design. I hope you can see my screen. I just shared my screen with everyone here.
Yes.
So this is Dharavi. For if anyone isn't aware of Dharavi as a locality, it's very crowded. The per capita income is actually not very low, but with respect to technology adoption, there is a challenge. So these are some of the major challenges that we had seen in this exercise. Lack of knowledge about digital interfaces, language barriers, text-based interfaces, lack of trust in digital information. I talked about rationing of data usage and existence of a specific worldview. This I'll talk about when I share my screens as well. Can you see the screen?
Yes. Actually, I was wondering if you could go back for one slide. Like, how did you figure those out? How did you realize this? Was this something that was part of your brief, or was this something that you discovered when you...
This was the discovery. And so there was proper research exercise that was done in these areas. So we had insights coming in from the research exercises. And at the same time, we did a very aggressive testing in this case, because research only takes you to a certain level. Sometimes we tend to miss some insights because this is the worldview that I was talking about, right? They perceive the world in a very different way. We see something happening, but what is driving that behavior is the real crux of the matter. And what decision that user is going to take at that point in time is what is going to drive the design decision. So the final design that we came up with was a third design that that was the third iteration, and that we tested with this audience.
Got it. And so I'm assuming it was like a lot of field studies. Is that how you did this?
A lot of field studies, yes. A lot of field studies, diary studies, interviewing, shadowing, talking to the doctors, talking to the mothers, expecting mothers, talking to their husbands. So if you can see the third screen here, the initial approach was that we take WhatsApp, YouTube, things which are very easily or very commonly used in that strata, right? So WhatsApp was on the rise, and YouTube, everyone watches videos. So we kind of took that and tried to design the interface so that it is known to them, and the adoption is easy. We fell flat on our face. Okay, so because of the data rationing, we did not know about. So initially, there's another content team that was working, and once they download the content, the person who is downloading can be in any trimester. Okay, they could be in 0 to 3, 3 to 6, 6 to 9. And if they download the wrong content and it is not relevant to them, then it's a problem, right? So in that case, there was a negative experience that we created there. So then we came up with something like this, what WhatsApp used to do. They'll show you the thumbnail in some blurred kind of an image, but they will also tell you how much data this download is going to cost you. Okay, so 1 MB, 3 MB, or maybe KBs if it is just an article. That solved the problem a little bit. But again, consuming textual information that heavy in a dense screen was very difficult for most of the audiences. So again, that did not fly. So we came up with something which I'll come to the next screen. So overall, what we did was we made it very simple for them. We made the decision-making very easy. So if you can see the first screen, it's an audio visual cue. They don't like to read too much. So if you can engage them with the audio, the message that comes, aapka bachcha kitne mahine ka hai, so that will come as an audio as well. If you are a user who doesn't want that audio, you can turn it off. But by default, you just speak. And even while you speak, you have to be very sure of the frequencies, because it is usually in a noisy environment. So the traditional outlook of designing applications, you can see how crude it is, right? And we usually have very finished applications. So it came out after a lot of iterations where we had to come up with these rich illustrations, but in a very simplified form for them to connect that via a mental model, right? And then they had to take help. How do you communicate? So we came up with this illustration which worked very well. So it was the complete image of the lady with all these red dots, the possibilities of what all thing can go wrong in a pregnancy, and you just have to tap on that particular. So if your shoulder is hurting, you just tap on the shoulder. It tells you what is happening other than that issue with that shoulder, and then you connect them directly to the doctor video call.
I remember you shared a couple of different problems with this. So you said you did a number of iterations on here until you came up with this. Could you tell us a little bit about your iteration process and how you kind of reached this as the best solution?
So the illustration part, we started with a very, very high def illustration, typical the trend that was going on with respect to illustrations in design. We started with that. And the challenge was connecting the meaning of those. Let me go to the next screen and show you what I'm talking about. So if you see the iconography and everything, it's very simple. It's very flat. So if you look at the first screen, we have visually depicted how a 0 to 3 would look like, 3 to 6 would look like, 6 to 9 would look like. So initially we did not do that. Initially we were very textual in matter. We tried to keep it simple, but then we had buttons directly saying that I'm in first trimester, second or third, and they don't register that. But when they look at it visually, it's very easy for them to make that decision. The time to decision making for the tap reduced significantly. So wherever possible, we tried to make it easy with respect to the audio visual assistance.
Got it. So I also remember you were saying there's different ways of finding the problem. One way was to say like, okay, here's a huge checklist, choose one or the other. And then you had another way, which was, so could you tell us a little bit about that process as well?
Okay, so see, we tried to create an ecosystem there with the doctors because as I told you, like the trust hierarchy works in that way. They trust the doctor the most. If we as an organization give them a solution on a digital device, it's as good as they don't take it, right? So we had to create an ecosystem ki doctor picture mein aa jaye. And that is where all this list of problems that that we're tackling for the expecting mothers come in. And the doctors also share a lot of literature as to what can go wrong, what could be the problem in particular trimester, how to resolve it, whether it is an emergency or not, whether it can be taken care of by a message. The customer care calls them and just explains them what to do. The major challenge with these people is that they don't know what goes wrong with their body because they're not aware of it. So for them, a lot of things are absolutely new. In a crude culture, things just flow generation to generation. That is where the mothers and the mother-in-law become very important in those kind of stages where they trust them more than the husband or anyone else coming in. So that ecosystem helps us come up with that list of set of questions and problems that can be pinpointed by these ladies, and then we can help them with the right solution. So the ecosystem is such, and after all these challenges, I think those were the major challenges I wanted to talk about. We simplified it a lot. We kept it very, very minimal in terms of UI, so that there's no cognitive load on them. The processing becomes easier, and we also tried to play around with two major aspects. One was the gamification bit, and the other was the community bit. So the gamification piece is what we designed for. The community is something that was planned for a very, very long duration, which we did not participate in later. So the second screen that you see here is the simplified version of what is in it for that particular lady. So I'm in pain, I need information, and I need help. That is a major categorization we did and made it very simple for them. So once you tap on it, there is help. Either there is a community worker who will reach out to you, or there's a call center who's going to call you, or a video call with the doctor directly, or other community behavior. So if someone else is around, they can just come to the help of that lady there. So that was the community bit. The gamification bit is interesting because we realized after iterating that videos were very engaging, and they were sticking really well to the video. So one video about the baby in the womb, they did not stop, they did not interrupt, and they completely watched it end to end. That was the cue for us that something like this might work, and giving them all at once wasn't really the thing that we wanted to do. So we wanted to tackle it trimester by trimester. So something that is meaningful in the last trimester may not be in the first trimester. So the content was created by a dedicated content team in an audiovisual form, which was very low data with a very simplified form of animation. So the point of this was the final offering. Okay, this was the simplified crux of everything that we did in those couple of weeks, was to give them one content piece every day, no more, no less. So that is that the curiosity is created that every day something is going to come which is relevant for me, which is going to help me in this condition, and going to unlock some offers for me or some freebies for me, which the organization wants to give, but they also want to change the behavior towards consuming this content, which is beneficial for them. So once you watch this video, 30 rupees off. Now you can go into a local ecosystem, you can go into a Kirana store or go to a doctor, and you get that consultation for that amount free. So that was the behavior which was accepted in our iterative testing. So this was it. And then you have all the offers listed. So even if you're not using it, you have an offer library where now if you need dry fruits, if you need something that helps you with nutrition, or your vaccinations or your other medicine. You can go to a medical store, show them the scoop and scan that barcode with them, and you'll get the medicines for that amount free. So this was the overall outcome of the entire exercise.
So what you were basically trying to do was, okay, what was the purpose of these deals? Was there a financial system that you had to worry about as well?
So there was a financial system. There were offers, there were freebies, there were tie-ups with the institutions, like for doctors, so that their doctors are readily available for that particular locality, where now you can unlock. Once you unlock, you will be readily available for a quick call if they choose to, for a remote consultation, or whenever they walk into the hospital. Even if there is a consulting fee of 100 rupees, you get 50 rupees off that consulting fee. So there is some benefit associated with it.
Got it. And was there a company that was also trying to increase the sales, or was this just like a completely non-profit kind of an initiative?
No, it was just for the community benefit. And the larger goal was to see how technology can help a particular society that exists in this capacity. And I think this was very well received in terms of the vision of the product. It was also published in the Stanford Innovation magazine for the kind of work these organizations were doing.
Awesome. And then what did your customers tell you? Like, what did the women on the ground say when you showed them this?
I think so. With the videos, I think they were empowered. They learned a lot of new things. And with the community bit, the sharing thing was being promoted. So if you like something, you share it with your known person, or even if a non-pregnant woman is looking at something like this on an app, they share it with the women who is pregnant. So the sharing between the community and creating those bonds within Dharavi, that was the overall idea of the community bit. And I think that was very well received. The people started sharing all these content because once they like it and they learned something, they wanted to share it with their friends and relatives and everyone.
Awesome. So the next question, and this was a case where you were given a challenge, you ended up going in the field, looking at the body of research that this other team had done, and then you iterated multiple times to get to this sweet spot. And every iteration you learned something new, like, oh, data is a problem versus somebody is not going to give the phone. So now, if you were in retrospect, you wanted to think about it, and you were to give advice to our folks here, how would you advise them? Like, given a problem of a similar scope or a similar challenge, how would you advise the community to kind of go about solving those problems?
Okay, I think what really worked well for us was the seamless integration of the content, research, design, and the tech team, because the testing that was being done on the ground was done without building an application. So it was on the device. It wasn't a real app. So that helped us to quickly iterate. And for the research, I think because we did it, we understand that we started with something like you see on the screen. We started with something like a WhatsApp grid, okay, because different levels of the society, so it might be very well received. There is absolutely no challenge about it, but when we hit it, we completely fell flat on our face. So I think research, understanding the user, empathizing with their worldview is something which I would definitely recommend to all the budding designers, that even when we feel that we understand what the other person is going through, sometimes we don't. Empathy is a very tricky thing. And I think empathy is not just about feeling in what situation he might be, but also about the world they live in, the decisions they make, the choices they make because of a certain preset biases. And so it's a very complex set. And I think there's no right or wrong answer to it. You have to understand it and test it. So if I have to look at it in retrospect, I don't think if we remove the testing and just keep the research, it would have worked. If we remove the research and kept testing, it would have worked. So it worked only because we did both the things.
So how long did this whole project take?
This was around 3 to 4 weeks of design exercise.
That's it.
So it was very quick turnaround. So that's what I was saying. We were lucky to have a team where the integration was very seamless. There was no leakage, there was no time lapse between the content, research, design, and tech. I think everyone worked very tightly.
Nice. And then one a question, like, when people look at these screens, there's one question that I'm sure will come up at some point is like, the tension between having like very rich visuals and very like, sophisticated styles versus having a very simplistic style. So, clearly in your case, you're kind of going with the simplistic style, and it's counterintuitive with what a lot of folks think about. So could you tell us a little bit about that?
I think that is also a journey that we took in the initial years. I think every designer wants to design the best looking product to their best capacity. And if you look at our Vimeo page, Wolf Talks page, you will see some really, really refined interfaces as well. We did interfaces for drones. We did interfaces for games, sports. Those are super, super chiseled. But I think a good designer is who really understands what is required in that moment for that particular user. So that was a learning for us as well. And when I look back at my team's work and our portfolio, we can see that diversity in terms of the designs as well. So I think the crudeness of this is not something we wanted to do, but that is something which worked with that audience. I think that's where design has to operate.